Good afternoon. Today we are going to talk about drugs and their effects on youth today. We start by defining the word drug. Drug is any substance that affects the body function either physically or mentally when consumed. Drugs can be categorized in different groups. The first category is medicinal drugs, recreational drugs, stimulants, depressants, hallucinogens, and others. Then we talk about the causes of drugs on youth today. The cause number one is peer pressure, which is most common. Youths may feel pressure from their peers to try drugs as a way to fit in or be accepted within a social group. Another cause is stress and coping mechanism. Youth face stress, trauma, or other emotional difficulties may turn to drugs as a way to cope with their challenges. The next cause is genetic and biology. Genetic factors can play a role in predisposing individuals to drug abuse, as some people may be more susceptible to addiction due to their genetic makeup. Another cause is mental health disorders. Youth with mental health disorders such as depression, anxiety, or ADHD may be more likely to be drug abusers as a way to self-medicate or elevate symptoms. The next cause can be family environment. Family dynamics, including history of drug abuse within family, parental neglect or abuse, and lack of parental supervision can contribute to drug abuse among youth. The next cause is availability of drugs. Easy access to drugs either through friends, family members, or drug dealers can increase the likelihood of youth experimenting with drugs. Another common one is media influence. Media portrayal of drugs uses in movies, music, and social media can glamorize drug use and normalize it among youth. The next one is lack of education and awareness. Limited knowledge about the risk and consequences of drug abuse can lead to youth to underestimate and dangers to use drugs. We look at some effects of drugs on youth today. Some effects may include, but are not limited to, physical effects. Drugs can be immediate physically, can have immediate physical effects such as increased heart rate, blood pressure, and body temperature. They can also lead to long-term health issues like heart disease, like liver damage, and respiratory problems. There is mental effects. Drugs can alter brain chemistry, leading to change in mood, perception, and cognition. This can result in feeling of euphoria, relaxation, or anxiety, depending on the drug. We look at behavioral effects, where drugs can impact behavior, leading to risk or reckless action, impaired judgment, and difficult in controlling impulse. The next effect is social effects. Drugs can affect relationships with family and friends, leading to conflicts and isolation. It can also result in legal issues and difficulties in school or work. Examples of drugs commonly used by youth today include marijuana, which can cause relaxation, altered senses, impaired memory, long-term uses can lead to respiratory issues and memory problems. The next common used drug is alcohol. It initially causes relaxation and lowered inhibition. Because excessive use of alcohol can lead to alcohol poisoning, liver damage, and addiction. The next drug is nicotine. It is found in tobacco products. Nicotine can lead to addiction and increases the risk of heart disease and lung cancer. Another drug which is commonly used are stimulants, which include cocaine, and can cause increased energy and alertness, but also lead to heart problems. Another drugs include heroin, prescription painkillers. These can cause pain relief, but also can lead to respiratory diseases, depression, addiction, and overdose. Lastly, we look at how can we help youth or drug addicts in our society today. We introduce education and awareness programs. Providing information about the dangers of drugs uses and addiction can help prevent drugs abuse and encourage individuals to seek help. The next, we can create support groups, encouraging participation in support groups such as Narcotic Anonymous, that is NA, or Alcoholism Anonymous, that is NA. This can provide addictive with sense of community and support in their recovery journey. We also introduce access to treatment like hospitals or rehabilitations, and this will ensure that drug addicts have access to effective treatment programs, including detoxification, counseling, rehabilitation services, which are essential. We can also offer family support and social support, which involve family members and friends in the recovery process and provide addicts with additional support and encouragement. We can also address and underline issues. Many addicts have underlying issues such as mental health disorders or trauma that can contribute to their addiction. Addressing these issues through therapy or counseling is crucial for long-term recovery. The last point, we look at promoting health lifestyle changes. We encourage our youth or addicts to adopt health lifestyle changes such as regular exercise, proper nutrition, and stress management techniques, which can help support their recovery. Thank you.